tail that wags.
We love our dogs like family because they are family. We want them to be healthy in every way, and we as dog parents tend to focus on our dog's physical health. But have you ever considered your dog's emotional and mental health? It turns out the canine and human brain are remarkably similar in structure and chemistry, especially when it comes to processing emotion. Scientists are realizing what dog lovers have always known. Dogs have feelings, hopes, fears, excitement, disappointment, and love. And like humans, a dog's brain can have abnormalities and changes. In addition, experiences can affect a dog's mental health. Did you know dogs have more instances of mental illness than humans? Mental health issues aren't regularly diagnosed in dogs because loving dog parents are primarily concerned with physical health, and symptoms of mental illness are not easily recognized. Furthermore, dogs rarely get autopsies, which determines if a dog has had some form of mental illness. In addition, dogs can have autism, also known as canine dysfunctional behavior. Autism in dogs can be difficult to diagnose. Those dogs have been determined to be born with autism, and the cause is unknown. So can dogs be psychotic, bipolar, autistic, or even have Down syndrome? Currently, there is no evidence that dogs can be bipolar as we know it because of the chemical changes in those who have bipolar issues. Dogs do not appear to have those same changes in the dog brain. However, it is believed in very rare instances that a dog can have Down syndrome. Some of the most common mental illnesses in dogs are dementia, phobia, PTSD, and depression. These are the conditions we'll focus on in this video. Dogs with good mental health live longer, physically healthier, and happier lives. There are things you can do to improve your dog's mental health. Knowing these illnesses and their symptoms will help you be aware of any abnormalities in your dog. Once you notice these behaviors, promptly consult your veterinarian. This will assure your dog will be treated, relieving your pup of any further suffering. Dementia is most common in elderly dogs. Canine cognitive dysfunction, or CCD, is related to the aging dog brain, affecting cognition. CCD changes behavior and specifically affects learning, memory, and comprehension. This disorder is comparable to Alzheimer's in humans. Dogs with dementia often get stuck in a corner or behind furniture, unable to understand they can easily back out. Dogs with dementia lose their ability to communicate with other dogs, and because of frustration and confusion, they may show aggressive behavior. Furthermore, dementia may cause dogs to forget or be confused with regular everyday activities and may not recognize familiar people or pets. Other symptoms of dementia include circling, wandering, and incontinence. Lesser known symptoms are lethargy, sleeping disorders, the inability to learn new things, and unusual barking, howling, or any other vocalization your dog may not normally do. Dementia can be difficult to diagnose as these symptoms can be signs of other illnesses. The cause of dementia is unknown, but there are treatments that can help your pup, which include diet changes, supplements, prescription drugs, and even surgery. Phobias are common in people and dogs alike. Phobias are different from fear, as phobia is an irrational fear and reaction to certain stimuli. It only takes one bad experience for the phobia to be ingrained in your dog's psyche. The biggest and most common phobia dogs face is with loud noises. Thunderstorms, explosions like fireworks can be paralyzing to your dogs. Dogs usually don't know where the sound is coming from or why it's happening. And dogs hear 4 times better than humans, so loud noises can be particularly terrifying. Other common phobias dogs experience are fear of being alone or separation anxiety, fear of the veterinarian, riding in the car, stairs, men, strangers, children, and specific objects like a vacuum cleaner. Treatment can be as simple as a thundershirt or as complicated as psychotherapy. In addition, medication and conditioning can be effective. Your veterinarian can help you. Post-traumatic stress disorder, or PTSD, is actual trauma a dog experiences. Canine PTSD, or CPTSD, was initially recognized in military dogs that returned from war. CPTSD is similar to human PTSD and experiences like a natural disaster, abandonment, especially abandonment to fend for themselves in the wild, loss of a loved one, human or otherwise, dog fights, serious accidents, being raised in a hoarding situation or a puppy mill, physical and emotional abuse, along with many other situations can stay with a dog for life. Dogs can display a litany of symptoms when he or she suffers from CPTSD: clinginess, sudden aggression, depression, and running or bolting. Treatments for this debilitating illness are effective. Desensitizing therapy exposes your dog to low levels of the stressor and gradually raises the intensity until the pup can tolerate the problem. One of the most commonly prescribed medications for CPTSD is Xanax. Xanax may be given to a dog singularly or in conjunction to behavior therapy or with other medications like antidepressants or beta blockers. People joke about their dog having obsessive compulsive disorder or OCD, also known as canine compulsive disorder or CCD. But CCD is a very serious mental illness. Conflict, stress, and/or frustration is a result of a stressful event your dog encounters. As a result, neurotransmitters are released with the stressor's response. Any dog can suffer from CCD, but specific studies show that certain breeds may have a genetic disposition to compulsive behaviors. Doberman Pinschers, Bull Terriers, Miniature Schnauzers, Labrador Retrievers, Golden Retrievers, and Irish Setters are commonly affected. Symptoms include pacing, circling, incessant barking, freezing, excessive drinking, licking the air, and various forms of self-mutilation. You may hear these behaviors and think, my goodness, my dog does those things. Our pups do all sorts of things we don't understand, but normally a dog will bark, bite at flies, or chase their tails. But if your dog does these behaviors at predictable times, stop doing them after a short period of time and function normally, your dog likely does not have CCD. However, if your dog has an extremely difficult time stopping these behaviors, even to eat or play, it's time to take your pup to the vet. One common compulsive disorder that needs to be addressed is canine lick dermatitis. A dog will lick his or her limbs in one or more sites. As a result, a skin lesion forms from repeated licking. Canine lick dermatitis is a compulsive behavior that can be initiated by medical issues like pain from an injury or anxiety like chronic stress. CCD is treated with increasing exercise, reducing or eliminating the stressors, and medication. One component to treatment is to not encourage the compulsive behavior because you think it's cute or funny. If your dog truly has CCD, encouraging compulsive behavior can be detrimental to your dog's health. And finally, depression affects both humans and canines alike. Though it's believed dogs don't suffer with the same complexities of this disorder, depression is common in dogs and can be detrimental to their health. It is believed depression in dogs is highly situational. For example, search and rescue dogs get depressed when they are continually subject to finding the deceased. One of the most common causes of depression in dogs is physical illness. Something as simple as a common cold can negatively affect your mood, and serious illness can evoke feelings of sadness and depression. The same goes for your dog. Grief is among the most common reasons for depression in dogs. a child who has grown up and moves away, a loss of a companion pet or playmate, and especially the loss of a human parent or caregiver can be particularly disturbing to your dog. Whether this loss is due to separation or death, it can be devastating to your pup. Other causes of doggy depression include moving to a new home, a new baby or person entering the home, a caregiver leaving to go to work after staying home for a considerable time, loneliness or boredom, and even an abrupt change in schedule can promote depression in your dog. Symptoms of depression in your dog is similar to depression symptoms in humans. Appetite changes like eating too much or not enough can be a sign, just like sleep issues. Dogs who sleep too much or not enough can also be a negative sign. Another telltale sign of depression is aloofness or apathy. Dogs losing interest in activities they once enjoyed, like playing ball or other games, warrant concern. Most importantly, if your dog has a change in behavior and/or attitude, it's time to go to your vet. Treatment for depression can begin with something as simple as spending more quality time with your pup to changing their diet. For persistent depression, medications like Plavix, Prozac, or Zoloft may be used, or even behavior modification can be an option. Although it may take up to 2 months for antidepressants to work, most dogs only need the use of medication for 6 to 12 months. Speak to your vet before employing a dog psychologist. Your veterinarian has been trained to detect physical as well as emotional issues in your dog and is the first best defense against any mental issues your dog may experience. You may want to see a dog behaviorist. Beware, anyone can call themselves a dog behaviorist or a dog psychiatrist. Do your research and seek out a certified applied animal behaviorist, a CAAB. These professionals have earned a master's or a PhD in animal behavior. Your dog is family, and you want them to be healthy and happy. Always keep an eye out for any changes in behavior and promptly go to your vet with any concerns. Remember, be patient with any physical or mental health issues your dog is experiencing. See your vet, because the earlier any potential problem is diagnosed, the better the outcome. Your dog will love you for it.